Thyroiditis. Thyroiditis means inflammation of the thyroid gland. It is mainly because of non-infectious causes. There are three types: acute, subacute and chronic. Acute means it takes the lesser time. It includes bacterial infection and fungal infection. Subacute is by subacute granulomatous thyroiditis, subacute lymphocytic thyroiditis and tuberculous thyroiditis. Chronic is by autoimmune thyroiditis, that is Hashimoto's thyroiditis and chronic lymphocytic thyroiditis and Reeder's thyroiditis. So today we are going to learn one of the important question in university exams, that is Hashimoto's thyroiditis. First, starting with the heading Hashimoto's, it is a autoimmune. Autoimmune means here we can see the autoantibodies. Next, chronic lymphocytic. Chronic lymphocytic means there is inflammation, and that is chronic inflammation, and we can see the lymphocyte. If it was acute, we can see the neutrophils. If chronic, if we can see the lymphocyte. Hashimoto's thyroiditis, it is a diffuse lymphocytic thyroiditis, stroma lymphomatosa, Gotrus autoimmune thyroiditis. All the three names are same only, and it is characterized by three principal features, that is diffuse, firm and goitrous enlargement of the thyroid, lymphocytic infiltration of the thyroid gland, presence of thyroid autoantibodies. So here there is goitrous enlargement of the thyroid gland, and we can see the lymphocytes in it, and autoantibodies are produced. Next, what is the age group? That is 30 to 50 years of age, third decade to fifth decade. It is most prevalent among the females than in males. Next, there is goitrous hypothyroidism, and it is seen in the people who consume high iodine diet, that is Japanese people. So Japanese people has more incidence of Hashimoto's thyroiditis. So as it is more prevalent in Japan, therefore a scientist named as Hashimoto discovered this Hashimoto's thyroiditis in Japan, and in 1912, and it is the first autoimmune disease of any organ. It means it was the first autoimmune disease which was found. Next, autoimmune pathogenesis of Hashimoto's thyroiditis. First, other autoimmune disease association means Hashimoto's thyroiditis is associated with other autoimmune disorders such as Graves' disease, systemic lupus erythematosus, Sjögren's syndrome, rheumatoid arthritis, pernicious anemia, and type 1 diabetes mellitus. And here SLE is a multisystem disease. Sjögren's syndrome includes the salivary gland. Graves' disease is a reverse of this type, means there is a hyperthyroidism is seen because of autoantibodies only. Next, immune destruction of thyroid cells. An association of the cytotoxic lymphocyte association antigen 4, that is CTLA4, a T cell regulatory gene. The CTLA4 is a T cell regulatory gene with autoimmune phenomena in Hashimoto's thyroiditis has been reported. There is initial activation of CD4 helper T cells, then there is infiltration of CD8 cytotoxic C cells, and there is in this process the B cell also come and produce the autoantibodies, which bring about the immune destruction of the thyroid parenchyma. So you can see the helper T cells, cytotoxic T cells, and the B cells which produce the antibodies. And those antibodies are the autoantibodies which causes destruction to the thyroid parenchyma. Now coming to the detection of autoantibodies. Autoantibodies, thyroid microsomal autoantibodies against the microsomes of the follicular cells, thyroglobulin autoantibodies, TSH receptor and autoantibodies. Less constantly we can see the follicular cell membrane autoantibodies, thyroid hormone itself stimulated autoantibodies. Next, colloidal component of other than thyroglobulin. So what is thyroglobulin? Thyroglobulin helps in synthesis of thyroid hormone. TSH receptor which regulate the synthesis of amount of the synthesis of thyroid hormone. Next, inhibitory TSH receptor autoantibodies. Here the TSH receptor are inhibitory because it is Hashimoto's thyroiditis, but they are excitatory in the Graves' disease. So I will read it, you can understand. TSH receptor autoantibody seen in the surface of the thyroid cell in Hashimoto's thyroiditis is inhibitory to TSH, producing hypothyroidism. Similarly, antibodies produced in Graves' disease where it causes hyperthyroidism. Means TSH receptor antibody is inhibitory in Hashimoto's thyroiditis and excitatory in Graves' disease. That why it causes hyperthyroidism in Graves' disease, and here hypothyroidism. Genetic basis, higher incidence is seen in first degree relatives. It is because Hashimoto's thyroiditis is seen often with HLA, DR3, DR4 and DR5 and Caucasians. HLA is human leukocyte antigen. Morphologic features. Pathologically, it is divided. Hashimoto's thyroiditis is divided into two forms, that is classical form and fibrosing variant. Grossly, the classical form is characterized with the diffuse, symmetric, fibrous and rubbery enlargement of the thyroid, which may weigh up to 100 to 300 gram. It is diffuse, symmetric, firm and rubbery enlargement, 100 to 300 grams. Thyroid is fleshy and well retained in normal shape and normal shape of the gland, but their size is enlarged. And another type is a fibrosing variant, which is firm enlarged thyroid, but the compression of the surrounding tissues is seen. Next, coming to the histology. Histologically, the classical form shows the following features. There is extensive infiltration of lymphocyte. As we know, the three principal features are goitrous enlargement, lymphocytic infiltration, and presence of thyroid autoantibodies. So lymphocyte should come now here. So lymphocyte, plasma cells, immunoblasts, and macrophages leads to the formation of lymphoid follicles having the germinal centers. Means the lymphocyte will come so much in the thyroid gland that there is formation of a lymphoid follicle in the thyroid. There is decreased number of thyroid follicles which are generally atrophic and often devoid of colloid. I will explain in the diagram. The follicular epithelial cells are transformed into their degenerated state called as Hurthal cells, also called as Azansky cells, oxyphil cells, or oncocytes. Means the thyroid follicular cells, they get degenerated and form the Hurthal cells. These cells have a oxyphilic or eosinophilic granular cytoplasm due to large number of mitochondria and contain large vesicular nuclei. There is slight fibrous thickening of the septa separating the thyroid lobules. What are the clinical features? How does the patient present to us? The patient present to us with painless, firm and moderate goitrous enlargement of the thyroid gland and associated with a hypothyroidism in a middle-aged woman. You remember whenever a question comes like a middle-aged woman and enlarged thyroid gland, it will be of Hashimoto's thyroiditis. And there is a serum T3 and T4 levels are decreased, and in few cases we can see Hashitoxicosis. Means instead of depressing, the autoantibodies will stimulate. It is almost like same phenomena work like Hashimoto's thyroiditis and grave toxicosis. And there is no increased risk of developing thyroid carcinoma here, but there is increased frequency of malignant lymphoma in these cases. As lymphocytes are more infiltrating, therefore there is chances of malignant lymphoma, not thyroid carcinoma. This is the microscopy of Hashimoto's thyroiditis. Here you can see the lymphoid cell infiltration, means lymphocytes came into the thyroid gland and the formation of lymphoid follicles is seen, and they also have the germinal center, and small atrophic and colloid deficient follicles are seen, that is thyroid follicles, and they do not have colloid. And the presence of Hurthal cell is also there, and abundant eosinophilic cytoplasm with vesicular nuclei. So here you can see the lymphoid follicle, two lymphoid follicles are there, and this is the lobular septa which separates, and these are the lymphoid follicles. See, lymphoid follicles not. These are the thyroid follicles. 1, 2. These are thyroid follicles, and in the center we should see a pink color colloid. In normal thyroid gland microscopy, you should see colloid, and here the colloid is absent. Therefore, these thyroid follicles are atrophied. And you can see the Hurthal cell here. Hurthal cell is nothing but the thyroid follicle epithelial cells only, but they get degenerated and more eosinophilic, filled with granules, and vesicular nuclei is present. They are known as Hurthal cells, oxyphil cells, or oncocytes. And you can see lymphocyte infiltration. The whole microscope is filled with the lymphocytes. Next, atrophied follicles. I think I have covered almost. Copy of Hashimoto's thyroiditis which we took in our lab, and here you can see there is in the microscope the whole slide is filled with lymphocytes. This you can see, these are all the lymphocytes, and there is atrophied follicles. Hashimoto's thyroiditis, lymphocyte infiltration, and the atrophied follicles. And it is not necessary like you should look at the Hurthal cells in this slide, but you should know that presence of Hurthal cells is the characteristics of Hashimoto's thyroiditis. So here we have one more microscopic picture of Hashimoto's thyroiditis. So here you can see there is a formation of lymphoid follicle. Here on lymphoid follicle and lymphoid follicle, and here you can see a number of thyroid follicles are there. Means in Hashimoto's thyroiditis there is decrease in the number of thyroid follicle is seen, and there is no colloid at the center. Here there is no colloid at the center of the thyroid follicle, and some fibrous septa will be separating these lobules. So we'll move on to the next picture. So here is the one more slide. So you can clearly say there is a formation of the lymphoid follicle here. Let me show you. So here you can see the nice lymphoid follicle. Means lymphoid follicle, they are nothing but the lymphocyte, plasma cells, immunoblast, macrophages. They form the lymphoid follicle, and this is the germinal center. And you can see thyroid follicles are present here, and some of the thyroid follicles doesn't have colloid in them. See, you can check here, and these are nothing but the atrophied thyroid follicles which do not have the colloid in them. Okay, I think you could have understand all these things. Here you can see nicely. You can take a screenshot of it. Okay, by this I want to end this video here. To see you in the next video. It's taking a lot of effort to make all these videos, so please do subscribe and share it to the needy person. तो गाइस आपको वीडियो पसंद आता है तो वीडियो चैनल को सब्सक्राइब करो और वीडियो को लाइक भी कर देना और आपके फ्रेंड्स को शेयर भी कर देना। तो मिलते हैं अगले वीडियो में, तब तक के लिए जय हिंद जय भारत।